Hello everyone. I'm Dr. Alex Sterling, a board-certified urologist. For over a decade, I've had the privilege of seeing and counseling thousands of patients right here across Canada. Every day, I meet men who wake up 5 times a night to go to the washroom. Men who wake up with no erection, no feeling at all. Men who avoid going out because of embarrassing urinary leakage. Frankly, these are sensitive and often uncomfortable topics that many of you haven't felt able to discuss openly. But with our aging population in Canada, more information about healthy aging is becoming available. However, most of this information only scratches the surface. Very few people truly explain the concrete methods you can actually practice at home. Today's video is the result of what I've learned from hundreds of real senior patients in my clinic over the years, and from my own clinical experience. What's truly astonishing is that many individuals have found significant improvement in their well-being simply by consistently incorporating this one practice into their routine at home, often alongside their medical care. The secret to sleeping soundly through the night without waking up for the washroom. The method to regain your morning erections. The way to restore intimacy in your relationship. I'm going to tell you exactly how to do it, specifically and very honestly. If you watch this video until the end, you'll discover a powerful, complementary method to support your prostate health and overall well-being, right from your own home, potentially reducing the need for more invasive interventions down the line. From now on, this is the real story about maintaining your dignity as a man. And the retirement years of those who know this will undoubtedly be different from those who don't. Did you wake up 2 or more times last night to go to the washroom? Does your urine only dribble out, not flowing strongly? Have you woken up to find no erection, just silence, and been startled? If you're nodding your head right now, this is absolutely not just getting old. This is a clear warning signal from your body. The problem is, most of you ignore or dismiss these signals. You think it's embarrassing or not something to talk about. And eventually, you end up regretting it on a hospital bed. I once met a gentleman in his early 70s, Mr. Frank Reynolds, who told me he used to wake up 3 times every night for the washroom. One morning, he fell and suffered a hip fracture, requiring surgery. The surgery alone cost him thousands of dollars, and rehabilitation took over 2 months. Simple urinary leakage and a weak stream were the beginning of medical bills costing thousands. Another patient, in his 70s, told me he stopped going to his regular community center because his underwear was constantly damp, making him too self-conscious to leave the house. His mood was low during the day, and he couldn't sleep at night, leading to a complete collapse of his overall health. And what many men don't talk about, the absence of morning erections, and no longer even attempting intimacy with their partners. This isn't just about low male hormones, it's a problem with internal circulation and prostate function. What was once taken for granted now feels impossible, leading to growing despair. This is the reality for countless men over 60. In reality, prostate issues in later life begin this way, leading to sleep deprivation, loss of confidence, and eventually, the complete breakdown of social life and intimate relationships. The most concerning thing is that if you neglect this issue, it can lead directly to a lifetime of managing symptoms with medication or even requiring surgery. Prostate surgery typically costs thousands of dollars. On top of that, recovery takes at least a month. During that time, your energy drops further, and your motivation hits rock bottom. This isn't just a urinary problem. It's a signal that can significantly impact your quality of life. But you shouldn't just dismiss this as a natural part of aging. This problem can be managed and improved. And anyone can start supporting their prostate health at home in just 5 minutes. The symptoms I've described so far, these changes, are your body's system sending you a warning. Your prostate is not a storage facility. Semen is the endpoint of a biological flow that must be expelled once produced. So, what happens if that flow gets blocked? Let me tell you precisely, your prostate can become inflamed and swollen. If semen isn't expelled and remains stagnant within the prostate, it can accumulate, potentially causing inflammation, swelling, and pressure. Eventually, the prostate can enlarge, and that pressure can even compress the urinary tract. Countless medical studies worldwide have already proven this fact. The one I often refer to is a long-term follow-up study from the United States. According to the research, middle-aged and older men who regularly ejaculated had a significantly lower risk of prostate-related diseases than those who did not. And another international study also reported that men who had a habit of ejaculating 2 or more times a week had a significantly lower incidence of prostate cancer. Even now, semen is accumulating in your body. That accumulation can be the cause of minor daily discomfort, the beginning of pain, and the starting point of a decline in self-esteem. Doctor, I understand that semen must be expelled. But what about those who rarely have intimate relations, or live alone? This is the question I hear most often in my clinic. And many give up before even asking it. At my age, what's the point? I don't need that anymore. But let me tell you, that is the mindset that can negatively impact your prostate health. Your prostate is an honest organ. If you don't expel, it can swell, and if it's blocked, it sends signals. That's where urinary problems, erectile dysfunction, and the loss of a man's confidence can begin. So, are you saying I should masturbate? Yes. Let me be precise. Masturbation is nothing to be ashamed of. It can be a beneficial practice for your prostate health. Just like you do strength training at the gym, your prostate, an organ in your lower body, can benefit from appropriate stimulation and expulsion to maintain its health. Shall I tell you an interesting fact? Many medical studies, including those from the American Urological Association, have shown that regular masturbation can have a very positive effect on maintaining prostate function. Surprising, isn't it? Countless medical institutions worldwide consider this a valuable component of a holistic health management routine. But what about us? It's embarrassing, it's shameful, I'm too old for that. And what accumulates? Semen and potential prostate inflammation. Remember this, semen is not for storage. It is a substance designed to flow. The moment the flow stops, inflammation can begin. I had a patient, Mr. Frank Reynolds, who started masturbating again for the first time at 73. He was the kind of person who said, "Oh, why would I do such a thing at my age?" But I told him to try it for just 10 minutes, twice a week, thinking of it as a beneficial exercise. And 2 months later, he told me, "Doctor, this has brought about truly remarkable improvements in my daily life. I'm not afraid of going to the washroom anymore. I was so surprised when I woke up with an erection just like I used to." You too can experience this. It doesn't matter if you have a partner or not, or if intimacy is difficult. The first step to supporting your prostate health is simply a small practice of stimulating and allowing things to flow for your own well-being. What we used to avoid, we can now transform into a natural, healthy routine. Now, I will tell you in detail how, when, where, and in what position you should practice this prostate health method. Even if it feels unfamiliar and awkward now, in 3 months, when your body changes, you will truly be grateful to yourself for watching this video. This is exactly what I've explained to thousands of patients in my clinic. First, when is the best time? I recommend doing it after a warm shower when your body is warm. Blood circulation is most active, and muscles are relaxed, allowing stimulation to reach the prostate effectively. So, where should you do it? A private washroom is often best. Do it in a quiet, undisturbed space after a warm shower. Or you can do it in a comfortable position in your bedroom. The most important thing is a sense of psychological security and a comfortable environment. What position is best? If you have back or knee issues, lying down is most comfortable. Otherwise, a semi-reclined sitting position is generally fine. Many people even do it while sitting on a bath chair right after a shower. The absolute key is a comfortable position that doesn't strain you. Next is the method of stimulation. This is crucial. If you do it half-heartedly, the effect will be reduced. Start gently, like a warm-up. Do not go too hard too suddenly. Begin by slowly and gently caressing the entire penis, stroking downwards. Take your time. Continue to stimulate for at least 10 minutes, not just the penis, but also the root and perineum. The prostate is not at the tip of the penis, but at the root of the penis, in the perineum area. Gently press the area between the scrotum and the anus while stimulating the penis. This will deliver more effective stimulation to the prostate. Stop just before ejaculation, then start again. This has a similar effect to Kegel exercises. Stopping and restarting can help strengthen the muscles associated with the prostate. Repeating this 2 to 3 times can be much more effective. Always use lubricant. If your skin is dry, stimulation can be uncomfortable. Use an unscented lubricant or a plant-based oil. However, avoid lotions or soaps. They can be too irritating and cause inflammation. Finally, here are some precautions. Never overdo it. 2 to 3 times a week, for 10 to 15 minutes at a time, is sufficient. Consistency is key. Don't be disappointed if it doesn't work after 1 or 2 tries. It's okay to feel awkward at first. Everyone starts somewhere. This is a practice for your health. Let go of the mental burden. Try it for just 2 weeks. The number of times you wake up at night may decrease. You'll start to feel your urine flow more freely. And after a month or 2, you might experience a surprising moment when you wake up in the morning. This isn't just simple masturbation, it's a medically supported prostate health routine. Start practicing it today for your own health. The effects of the prostate health method we've discussed are not just about a strong urine stream and regaining morning erections. This is literally a habit that can revitalize your entire body. This is because semen is not just a substance involved in reproduction. Various components of semen play an important role in stimulating and regulating our body's blood vessels, nerves, and hormones. Regular ejaculation itself is an act that can help kick off the entire body's circulation. Just as a river that doesn't flow for a long time can stagnate and become murky, if circulation in our body becomes stagnant, it can lead to various health problems. Let me give you an example. Mr. David Miller, a 76-year-old gentleman from Edmonton, told me that for over 10 years, he felt heavy and had back pain every morning, making it very difficult to get out of bed. But 2 months after starting the prostate health method, he said, "It's strange. When I wake up in the morning, my head feels clear, my body feels light, and my back pain is much less. I'm less tired throughout the day." Why did this happen? First, your heart gets healthier. Ejaculation is not just expulsion. It is a powerful stimulus that promotes blood circulation. When the prostate is stimulated, blood flow around the pelvis increases, which can help the heart circulate blood more effectively throughout the body. It's like electricity flowing through a previously hardened circuit, waking up the entire body again. Especially for men over 65, improved blood flow around the prostate can significantly reduce aging symptoms like lower body swelling. There are even studies suggesting this can contribute to reducing the risk of cardiovascular disease by up to 18%. What changes when blood circulates more powerfully from the heart? All cells receive more oxygen and nutrients. When cells are activated, tissues and organs naturally become healthier, leading to overall physical function improvement. Second, your mood can improve. When semen is expelled, the brain releases happy hormones like dopamine, oxytocin, and endorphins. These hormones can help lower depression and boost confidence. It's what we call a mood-boosting effect. Recent studies show that regular ejaculation can reduce stress hormone levels by up to 22%. This is especially significant for the chronic stress issues many face today. The refreshing feeling when you wake up in the morning, the positive mindset that lasts all day, the patience to not get angry over small things, these changes are not just coincidences. Real changes can be happening in your brain. Third, your immunity can get a boost. When semen doesn't remain stagnant in the body and is regularly expelled, lymphatic circulation can become much smoother, and inflammatory substances may begin to decrease. Immunologists' recent research suggests that regular ejaculation can improve the quality of white blood cells. This effect has been particularly noticeable in men over 50. Fourth, your sleep can change for the better. Patients who consistently practice this health method often share a common experience. I go to the washroom less at night, so I sleep more deeply. My head feels clear when I wake up in the morning. This means that improved sleep quality can also enhance brain function. In fact, a Japanese geriatric medicine study found that regular prostate stimulation can improve sleep patterns in older adults and increase the proportion of deep sleep. This can also help lower the risk of degenerative brain diseases like dementia. Finally, the muscles in your lower back and glutes can become firmer. Ejaculation is also a practice that naturally contracts the anal, perineal, and pelvic floor muscles. This can have a direct positive effect on urinary incontinence, lower back pain, and lower body circulation issues. The pelvic floor muscles, in particular, are sometimes called the second heart because when they strengthen, blood circulation in the lower body is promoted, which in turn can lead to improved systemic circulation. Remember, everyone, it's not just your prostate that gets healthier. This is a habit that can rejuvenate your heart, your brain, and your back. Isn't that wonderful? It's not too late. This health method can start tonight, or even right now. Many people still don't realize that this small act of ejaculation can have such a profound impact on overall health. But you know it now, don't you? This isn't just a men's issue. It's an issue for your entire life that can significantly enhance your quality of life. Now, I'm going to tell you what can happen to your body if you don't incorporate this simple routine. Some of you might be thinking, well, not doing it won't kill me immediately. But I'll tell you a story from my own clinic about what happened to someone who thought exactly that. Mr. Frank Reynolds, 73, when he first came to see me, said, "Doctor, I just want to urinate more freely. But I keep seeing blood, and it takes so long to go." The diagnosis was stage 2 prostate cancer. His prostate had become so enlarged that the cancerous mass was pressing on his bladder, and he needed surgery to remove that portion. Does this sound like someone else's problem? Most people think so. And they neglect it until they're lying on the operating table, filled with regret. Those of you watching this video now have a choice. You can actively support your body's health with just your fingertips. Of everything I've said so far, the most important thing is just one: start right now. This doesn't require a big decision. A small practice is enough. It's not a hospital visit, it's not medication. It doesn't cost money, and you don't need anyone's permission. It's simply about revitalizing the flow within your body with your own fingertips, and it's possible tonight, right now. If you turn off this video thinking, okay, I'll try it later, you probably never will. There is no later. Your health won't wait for you. Today, I met countless seniors in my clinic. And I realized, you have to practice to live. If this video felt like your story, try it tonight, even for just 10 minutes. And tomorrow morning, when you open your eyes, listen to the signals your body sends. If something feels different, your transformation has already begun. Share this video with your friends and family. There's nothing to be embarrassed about. Your one share could change someone's life. And please leave a comment, starting today, or "I tried it." Your courageous comments can be a great motivation for everyone. Subscribing and liking are free. But the health information you gain by doing so can completely change the rest of your life.